Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to discuss some of the latest trends impacting the industry today. My name is Justine Gincola. I'm on the corporate communications team here at Inovalon, and joining me today is Todd Sharp from AWS. Thanks so much for being here today, Todd.
Thank you for inviting me to share some of our industry perspectives and things that we see every day.
Yeah, absolutely. You know, a big topic that we are seeing kind of take the spotlight lately is AI and machine learning. What would you say are some of the most exciting applications in healthcare right now as it relates to AI and ML?
Yeah, that's a great question because if you look at nearly 20 years of my career in healthcare, what we often see is de-risking by following what some of your peers are doing in collaboration. We see these patterns emerging with AI around healthcare as well. But we see a little bit of granularity in it. So you look at different subsegments between payer, provider, pharmacy, benefits management, life sciences. You have slightly different answers. At the highest levels, I think most of AI's use today is being used in administrative areas in terms of intelligent document processing to create efficiencies, and also in augmentation of knowledge. So whether that's augmentation of a customer service staff or a patient financial services person, or potentially a care coordinator in a payer environment where they may know their job very well and how to work with the patient or the member, but that augmented knowledge gives them the ability to tap into a much deeper, richer solution set in answering questions. We think that over time, we're seeing this now, certainly clinical. There's a lot of work being done on the clinical side, a lot of work being done on the revenue cycle side. And of course, the last few years, thankfully, we've seen a big focus on social determinants of health from a population health perspective. It's important that when we consider for a moment that most of the research or treatments or therapies that have come out in the world, the estimate is over 80% of them have been developed for Western European genetic profiles. So if you look at the rest of the globe, it's important we start considering social determinants of health to put the needs of other populations squarely at the center, because they could have very different treatment options and opportunities to help them in their healthcare journeys.
So really, AI is touching so many different areas of healthcare. Sounds like a lot of positive impact. But what would you say that all of this means for, let's say, the next 5 to 10 years in the future of healthcare?
Well, again, I don't want to rely too much on the individual sub-segments, but there are differences, obviously. I think what we are seeing emerge is, over the next 5 years or so, much more collaborative enablement around artificial intelligence, generative AI, machine learning technologies. We see data that supports globally that, particularly here in the United States, though, when payers and providers collaborate, you can decrease the cost of delivering healthcare over the lifetime of a patient by at least 18%. That's a significant number when you look at 20% of the United States GDP is spent on healthcare and related issues. 18% of savings over the life of a patient would be huge when you scale it out across the United States. We look at the ability to have those collaborative fabrics brought together through AI, where not only a payer and a provider or an ACO as we shift to value-based care, but also even in a fee-based care environment, looking for the opportunities that we might be missing. Are there labs, treatments, or regimens, things that could be suggested in an augmented way to a clinician where that clinician can hopefully click through and actually see citations so they themselves can be satisfied that any augmented assistance through AI is actually providing them something that's based upon sound knowledge and not just generating a response that a provider themselves is expected to follow.
So, again, we've talked about this in a lot of different conversations, that these impacts are positive. However, we also hear the side of, kind of the skeptics. What are the limitations? So while there is a lot of good to be had by AI and ML, what would you say that some of the limitations of data and machine learning that healthcare professionals should keep in mind?
Two sides to that story, right? One is healthcare. We tend to not innovate in bursty amounts of energy in brief amounts of time. If you look at the large data sets around hypertension management or diabetes or cardiac, if you look at that over time, we've had small incremental improvements over long periods of time that have, on the whole, led to relative improvements in healthcare. I think AI represents a little bit of a challenge because it's a bursty capability that today is working in background areas very efficiently and effectively, but soon will be front and center in front of patients, their families, providers, and revenue cycle specialists throughout the entire care continuum. So I think we need to be better at building into our leadership academies, our training, and our onboarding in terms of how our staff, our human capabilities, are going to merge and blend with artificial intelligence, are going to look at data and informatics and analytics at the basic level so that we are prepared as a workforce to better handle and integrate with those capabilities as they continue to come through in these bursty ways over the next several years. On the downside, I feel like if you look at, again, the human workforce, that's almost our Achilles heel in some ways. In the United States, we have studies recently that have come out that show that, almost 15% of our overall staff, regardless of whether you're patient, provider, or payer in different areas, the staff that's supporting are looking at changing their careers, getting out of healthcare entirely, regardless of what segment they're in. You look at almost 35% of everyone working in healthcare today that are looking at changing their jobs, moving to either a different job or a different organization entirely, largely due to dissatisfiers within their leadership chain or the way that they perceived healthcare to be before they came in. The pandemic, not to throw back a few years, was transformative. One of the things that it did is it left us with a legacy of young people who are coming into the market, who are coming into the industry, who are infused with inspiration and want to do good work. If we're not prepared to support them on their career journeys, I don't think we're going to see anything but additional erosion as they then drop out 2, 3, 4, 5 years into their careers, because they're not like the greatest generation or the boomers or the Gen Xers. Each generation has its own uniqueness in terms of how it relates to other people and how it relates to technology. So it's up to us who are in the industry today to create pathways for them that blend them not only with the people that they wish to serve, but the technologies that can help them do so.
Absolutely. I think it's a great point. One thing I do want to touch on as we kind of close today is, the Inovalon and AWS collaboration. So I want to share some of your thoughts on that.
Yeah, it's exciting. I said something earlier, and it's something that we say at Amazon universally, is that data has gravity. If you look at healthcare and you look at where I came from over 15, 20 years ago, working with large data sets, doing predictive analytics, working in big data and such in healthcare, it was siloed data. The challenge then was grabbing data from different disparate sources and pulling it together. And that was the lion's share of the work, getting it there, normalizing it, and being able to make sense out of it. As we move forward, organizations like Inovalon, you have large sets of data that you've already done the heavy lifting and the working on. And so it really liberates our capabilities to apply technologies, whether that's artificial intelligence, machine learning, predictive analytics. You're doing a great research series right now with Harvard Medical School, Harvard University, around research data and how it's impacting us at a real policy level in the country. So I'm encouraged and excited, not only because Inovalon brings its expertise and its data, and Amazon brings our expertise and our capabilities, but that we're both doing something I think that is innovative, and that's working backwards from real problems to bring real solutions forward together faster for our customers and their customers and patients.
Absolutely. Very well said, Todd. Thank you so much. And thank you for joining us today. It was great talking with you. Thank you to everybody who tuned in, and stay tuned for our next episode of the Innovator series.
Thank you so much.